All right, welcome to In the Zone. I'm your host, Garrison Roy. And if you're new to the show, welcome. We help guys get in the zone, whether it's, we're talking more of the physical side, the mental side, or even just actually the overall performance of them getting in the zone and, getting guys out, sending them back to the dugout. So for this episode, we have a full length interview. But if you have any questions, topics, or guests you want to send in the podcast, you can do that in the zone podcast 123 at gmail.com. And if you get anything out of this, you get some value, made you think a little bit differently, or, maybe you agree or disagree, share the show, right? Because I don't run ads or sponsorships or monetize the show in any way. So I want you guys to continue to pay it forward because this is all free information for you and to help grow the game. So yeah, looking forward to this episode. And for Jenn Marcello, consultant for pro and college teams, welcome on.
Thank you so much for having me. Appreciate it.
Yeah, no, I was definitely looking forward to this, and we've had conversations in the past with a few athletes I've had worked with previously. I really like your perspective on a lot of stuff, but give the audience a little bit more of your background and what your kind of what led you up to where you're at now.
Sure. So undergrad was exercise and sports science at the University of Florida, which was heavily biased towards strength and conditioning. That was always kind of an interest, passion of mine. So I spent a lot of time obviously learning that through school, loved biomechanics, also loved the sports injury side of things, which made me at the end of the 4 years say, you know what, I think I want to pursue something in the medical realm. I thought about physical therapy, but at the time, this was, back in 2002, when physical therapists really didn't have direct access to patients. They didn't have a broad scope of ordering MRI and X-ray. So I kind of took this like left turn, so to speak, and went to chiropractic school. Entering the school, obviously, with a little different philosophy than most, but it was very useful. Obviously, kind of gave me the background with regard to orthopedics. And it led me eventually to doing my first job at University of California, San Diego. So
Nice.
in that,
Very
I
cool.
was obviously surrounded by a number of athletes, but kind of grew a fondness toward baseball and softball and tennis, and was there for about 7 years. Fast forward, I went to a private sports training facility, ran the rehab out of that facility, in addition to a PT group. We kept gaining more and more baseball players within off season and whatnot. Padres being a big group of that. I was in San Diego, obviously, and
Makes sense.
it became so pronounced that the Padres ended up bringing our PT group, our rehab group, into their organization. So I spent a year solely with the Padres on the rehab side of things, and that really kind of got my itch for baseball. That was back in 14, 15. From there, I took a year off, had a baby, and then we decided at that point we're going to move to Florida, be a little closer to family, and had a second baby at that point. And lo and behold, I went to like a TPI course and met some of the staff for the twins and created a good relationship there, and ended up pulling me into their organization as their rehab, strength and conditioning. It kind of morphed into this utility almost player where I was on the medical side, but I was also on the S&C side, and then really grew a kind of fondness and closeness to the pitching staff. And they kind of took me underneath their wing to say, how do we improve mechanics? Is there something that we're missing from like a cueing standpoint, or some of the drills that we're doing? How can you help us here? So it morphed into this kind of baseball position out of something that, I guess I grew this love for rotational sports.
No, yeah, I love that. It's really cool that, you actually are, or you were that type of link from, what I see a huge gap in is that medical side from the actual, practical application, either strength and conditioning or even the skill side, right? So you being able to speak both languages, so to
Yeah.
speak, is it speaks volumes, and for you to be able to help everyone kind of get on the same page, right?
Yeah, I
So
think what's interesting is when you talk to people in the professional sports organization, that's always the top like sticking point is, how do we get everyone to collaborate, right? How do we get all these
yeah,
groups to start talking together? And I definitely think it takes people that can speak the language of both sides. How does this side complement what this side's doing, which ultimately goes toward the goal of their performance on the field? So it's a challenge, but I think when you have when you can look through the lens of all of these different categories, it helps to bring everybody together.
Yeah, no, that's huge. Whether it's pro org or really any college
Yeah.
or private sector to private sector, right? Like having a collaborative approach goes a long way. And I love this was like back in December of 21. I went over to the Dodgers symposium, not to go like
Right.
the rivals with Padres Dodgers, but
Right.
I went there and they were like, yeah, we don't like to have silos, or like, oh,
Yeah.
so you're introducing people over here,
Right.
all the pitching people or hitting people over here, right? Like they were actually and demonstrated it while they were there. They were like one um strength guy like came over and like talked to the pitching coach like, hey, this guy, what are we doing? Like, what's he working on? And then they were like, oh, hey, yeah, I like this. And the pitching coach already had like somewhat a feel for
Yeah.
the background. So I was like, oh, wow, this is actually how it's supposed to be.
Right. Yeah.
Yeah.
Yeah. And I
Which
think to your point, it's like sometimes when we look at something through one lens, like if I'm looking at biomechanics or I'm looking at the health of an athlete, I might
Mhm.
say, gosh, I really want to correct that crossbody stride. Like it's putting a lot of load through the spine or whatever it might be. But then if you talk to a pitching coach, they may say like, hey, you know what? That crossbody stride adds some deception and it does X to the ball, which is important, right? So it's like, okay, that's something I don't want to quote unquote fix. Hence why it's important to have those conversations with your skill guys.
Oh, 100%. Because if you make some of those changes
Yeah.
physiologically, and then it also changes the pitch metrics
Yeah.
for good or worse, right? Like
Right.
it doesn't really it's hard to tell if you want to be
Yeah.
able to do that. It's really complicated, especially when there's millions of dollars on the line for some of these
Yeah.
guys, right? Like it's like, hey, this could make you a lot better. Like a good example would be like, hey, like this guy's biasing supination a lot. He cuts a lot of his balls.
Hmm.
And even the pitching side be like, yeah, your efficiency is not the best, but
Hmm.
he's getting results. He's getting dudes out. And we're like, should we even bother?
Exactly.
Probably not.
Yeah. Monitor and proceed with caution.
Yeah,
Right.
100%. So what I guess with you having some of that pro experience, those conversations that you were having with them, was it, kind of being like, all right, like performance is really the top thing that we're
100%.
talking about. Yeah.
Yeah. I mean, it's obviously what are they doing on the field? That's the most important thing. Right. And then from there, we can start to peel back and say, um, is this a health issue? Like I said, is there something we need to do from a health perspective to keep him on the field, right? To be able to perform what he's doing? How do we improve what we're seeing, but yet not take away from performance? And that's where a lot of your metrics come into play, right? Like, what are our KPIs? Let's keep an eye on these measures while we're working on the scat position or, a thorax that can rotate better or whatever it might be. While we are improving those things and seeing the changes from our side in terms of sports medicine or even in the weight room, let's monitor the KPIs on the field, because if it's creating an unfavorable change there, we need to maybe pause where we are, give back the other way, et cetera, et cetera. So all of those conversations need to be happening in real time to know how far to push or pull in one direction.
Oh, for sure. I guess really more when in your setting, you were probably doing this when guys are either like ramping up for spring training or
Mhm.
mid-season. So you definitely don't want to have like a lull or like a what's the right term I'm looking for? Like if you decided to make a change, obviously
Mhm.
sometimes when you do that, like they might lose feel for some things, like spray balls everywhere. Um, so I guess do you save more of those like larger overhauls that might cause some of those type of effects for more off season? Do you also do that in season, maybe
Good
depending on
question.
what their availability
Yeah.
is?
I think it depends on the case, right? If the
Sure.
guy's performing great, and there's obviously something with regard to injury or tightness that seems to be creeping up, we might make the changes to the point that symptoms have subsided,
Mhm.
right? But yet we see that they're still performing well and they're able to deal with the changes in body position, right? Increased ranges of motion, et cetera, et cetera. Um, if it's something in the off season that's like, okay, we got to overhaul this guy, right? Like, sure, we're probably going to make some big changes. And
Yeah.
so obviously that doesn't, we give him time to ramp up during the off season, right? During bullpens to gain the new feel for what we're trying to, accomplish overall. and if it's in season and the pitching coach is like, hey, his load is doing this, or we see this issue with command, again, it might be little tweaks here and there to see if we can get the change that we want and get in the sweet spot without, again, overhauling or making big changes to the system.
Yeah, no doubt. I like that. Because it's always kind of in the back of your head. It's like, hey, am I gonna get this guy, better? You always want to make a decision based on if it's gonna help them or not. And it's almost kind of a simple, like, Hippocratic oath thing is like, hey, no harm, right?
Yeah.
So
Yeah.
yeah.
And again, this is where like your three departments, like on the sports medicine side, if I'm doing a lot of manual therapy with somebody, right, and then I put it into some sort of basic, elementary exercise, right, then at that point, it's like the S&C department needs to now create, how do we take that simple movement, add some load behind it, add some rate of force development so that it starts to mimic what they're going to do on the field. And then the conversation needs to happen with the pitching coach to say, what sort of plyo drill or throwing drill are we going to now utilize that ties in these sorts of mechanics that we just created from the manual side, built up from the S&C side, and now we're going to actually put it into the skill of throwing. So again, having all departments going toward the same goal and building that kind of new system, so to speak, from beginning to end, is paramount.
Oh yeah, definitely. I think too, it's you're trying to find, kind of going off the tangent here on more of the manual tissue work that you would do, right? I've seen this a lot, and I've for several different facilities I used to work in. Like, it seems like a lot of issues where some guys are like, hey, I have bicep pain, but then they think that like doing stuff just for the biceps is actually going to fix it. But
Right.
obviously that's not the case from what I've seen, right? Like, you got to zoom out a little bit more, obviously, in regards to like, what they could actually get treatment for based on,
Yeah.
Healthcare, like, appreciate you, but, they zoom in and just look at the bicep. So
Yeah.
you gotta have to zoom out and be like, all right, hey, some of this bicep pain's actually probably coming from your shoulder.
Yeah.
So
Yeah.
I guess like a common injury, let's say for bicep tendonitis or, just bicep flares, what are some common like manual therapy things that you've seen that have helped out with that in regards to the shoulder? Kind of giving you a layup here. But
Good question. Yeah. So I'm going to take like a real broad approach on this one. And I think to your point, I love what you said about kind of zooming out. Most of the time, if it's an elbow, if it's a shoulder, if it's a back, like that's the site of pain, but that's not necessarily the source of what's causing it. And so as you know, from the S&C lens, right, looking at your global tests, right, to tell you, what does a toe touch look like? What does a standing rotation look like? What does a squat look like? What does, all your shoulder ranges of motion obviously look like?
sure, global ranges.
Yeah, I'm a big fan of start proximal and work distal. So I want to see first and foremost what a spine and a rib cage are doing. That really seems to be, I think of it as like the trunk of the tree, right? If the trunk is solid, the limbs are going to be able to do what it wants to do. So some of the things that I tackle first are, do I have a rib cage that as I go to turn to the right, it can open? Right? It can expand, which would be considered external rotation. And when I turn the other way, can it close? That would be considered internal rotation. When you have a rib cage, right, that has these rotational qualities, the spine also turns with it. And this is coming from a chiropractor who, like, loves spine stuff, right? So I think spine gets a lot of the golden glory and the attention. But if you don't have a rib cage that can support that, and in addition to a sternum, like that whole piece works as a spring. I hate the word cage because that makes it sound like it's a solid object that doesn't have.
You think like a bird cage kind of thing.
Yeah, 100%. Right. You think of it perfect, a bird cage. So again, it's like, do I have this cage that actually has these spring properties to be able to turn? And as a result, obviously the scapula are attached to that. Right. And if the scapula have now the ability to create turns on the rib cage is supporting what the scapula should be doing. Now I set up the humerus, which is attached right to the glenoid, the socket of the shoulder. Now the humerus has much more free reign to do what it needs to do. So those are kind of my checks. And whether that's a biceps tendonitis, whether that's a shoulder impingement, right? Those are kind of the foundational pieces. I tend to like, okay, great. It's a tendonitis, whatever. It's an impingement. Like, these are all just medical diagnoses, but at the core of it, what's not moving? What's not participating in this action that needs to happen, which is now loading a tissue, a joint, etc., in an unfavorable way.
Oh no, 100%. And what you said there, I totally agree with, because a lot of people, they think in either isolation of just the spine, but they don't think about how all the other pieces are working together.
Right.
Even for example, like how the scap will be able to like actually move around
Yeah.
the rib cage, but then also how those ribs are coinciding with that, right? Like you could think of it as more of like a thoracic outlet syndrome, right? Like
Yeah.
if that's kind of stuck right there and those
100%.
components aren't working together, that's where you have those kind of symptoms kind of spring up. And if my dad's a chiropractor. I don't even know if I
Oh, no
told you.
kidding.
Yeah, so I have a little bit more of like a background. He
Yeah.
went to Logan,
Yeah.
but more upper cervical type stuff. And you think
Uh-huh.
about that, like I have guys where they would do like a test like this, and they'll go
Uh-huh.
to horizontal abduction and then turn their head to the left to the right, and there's like an actual like spring component to that. And I'm kind of referring to a post that I recently just saw,
Mhm.
anatomy links, and I'll drop that in the show notes for you guys to check out, which was really good. But you know, the rotational capacity of that cervical spine like actually helps spring forward a lot of other things, right? A lot of people just think like, if you're missing that cervical rotation, it's like, oh, you'll be okay, but like it actually affects a lot of other things further down than people
Yeah.
think.
To your point, when you're in that position that you just demonstrated with kind of horizontal abduction of both sides, you're really compressing that upper back, right? So you're taking, think like rhomboid, upper trap, paraspinals, et cetera, and you're compressing the heck out of that space, which will limit but just by what you're doing will limit some of the cervical rotation. But if you get a guy that is already limited in general, right, that space for them is already restricted, the upper thoracic area does not move very well, and you compress it even more, then you can really pick up those limitations in cervical rotation, which is like, okay, this guy, he's already, pretty limited here on mobility, tissue quality, et cetera, in general. And now we're really picking it up because we've locked it out to see what's left.
Yeah, no, 100%. Definitely love seeing it from that angle, because you're seeing like, okay, hey, what's compressed or what's actually
Mhm.
expanding or lengthening, I guess, in terms of like muscular tissue, right? It's like what's
Yeah,
contracted, what's
right.
being lengthened.
What's shorten, what's lengthen. Yeah, absolutely.
Yeah. Well, I think we would probably go on a tangent with, cross, uh, what's it? Cross syndrome, where they're like this, kind of
Oh
just
yeah. So Yanda's upper cross syndrome.
upper
Yeah.
cross. That's what I was missing. Yeah, upper
Yeah.
cross. Yeah. Because there's a
Yeah.
lot of guys who, they're sitting on their phones or, hunched over all day doing a thing, and then they try to get into that super
Yeah.
extended position, and they're stuck there because they're spending a lot of time with that forward head posture.
Yeah.
So
And I think that's what makes movement so hard, right? Is that you have all of these influences, right? Whether it's the postures that they're assuming all day long from sitting on their phones playing video games, right? Is it influenced from what's happening in the weight room, right? Is it
mhm.
influenced, obviously, what's happening from a throwing perspective? All of these have these influences on how the body moves. And sometimes it's tough because we're trying to make the change, but we don't see what might be the key influence, to your point, like sitting on, their phone or playing video games all day long. We're working on all this other stuff, but yet that one behavior is still present, which is kind of driving some of the negative things we might be
Yeah.
appreciating.
Oh yeah. A lot of people don't understand how much one thing affects everything. It's like, hey, yeah, you might go train for an hour, but if you spend 3 hours in front of a TV playing video games, not that you're counteracting it. I don't want to think of it that way, but it's like,
No. Yeah,
you're putting yourself kind of at a disadvantage, I guess.
sure.
Probably be the best way to say it. But I kind of shifting gears here, but also kind of on the similar topic of like other things influencing things, would be kind of like how shoes and feet, and me being on
Yeah.
the wearing two different hats, strength and conditioning, and also the pitching specific side. Like I've always
Mhm.
noticed guys who wore, back in the day, it was like Nike Freeze or whatever. There was no lateral support, and they were slipping around left and
Yep.
right. So I actually had a lot of guys just like, we're starting our warm up, and I like to start from the ground up. I'm just like,
Mhm.
take your shoes off, because
Yeah,
I don't even want to see you sleeping out of those. Take your
sure.
shoes off. We'll go into, just kind of walk on the toes, walk on the heel,
Sure.
inversion, eversion, however they want to do it, or whatever they call it. Just like, hey, walk on the outsides of your feet, walk on the inside, to just wake up the foot, right? Because it's not used to moving in all those different positions, because they're always stuck in shoes.
Sure.
But yeah, and that was something that we talked about on a call a while back, and just wanted to kind of let you run with this topic a little bit.
Yeah, I think, shoes definitely interesting. Feet, very interesting. I'm going to dive into that, I think, with you quite a bit. But one thing that I've noticed with cleats, the majority of cleats that I've seen
Mhm.
have a very kind of supinated heel, right? Or think kind of inversion. And for some people that might be helpful, for I think a lot of pitchers in general, that it kind of pushes them into a certain position of the foot that doesn't allow the heel to unlock, meaning that we talk about calcaneal eversion, right? The heel moves outward, which is kind of like the first domino when you kind of get into the load position. So it's interesting because, for whatever reason, most cleats that I've seen have that sort of bias. I think that I've been in communication with a guy that is from the golf world, and I feel like golf's like 10 years ahead of baseball, right? It's like whatever
Oh,
they're doing, like
100%.
we're
Well,
slowly catching
there's
up,
more
but
money
sure
in
enough,
it, more
yeah,
people,
right.
older
Totally.
guys that are just like, hey, I'm trying to get my swing right. Like, how do
Yeah.
I do this?
Yeah, how do we do this?
Yeah.
So in typical fashion, I think the baseball world is starting to take notice of shoes from the golf side to say, hey, this shortest shoe might be better for this athlete because there's more of a varus heel or a valgus heel to it. So I'm starting to see more variation in the type of cleats that are coming out, which is good. And then to your point, like going barefoot, I think is fantastic because again, it gets your foot in contact with the floor. We have so many proprioceptors on the bottom of the foot, right? That give the brain kind of communication of where your center of mass is, where your body is in space. So I love that idea of a warm up, starting without shoes first, and to get things rolling. But yeah, can I share my screen real quick, and I'll
Yeah, you definitely can. Let me give that you access. You should have that.
yeah, we're good. Yeah. So this, our kind of conversation really was spawned off this tweet that I put out with all these different types of feet. And I think feet can give a coach, whether you're a skill coach, whether you're on the S&C side, obviously on the medical side too, it can give you perspective of where someone's center of mass might be. Is it forward? Is it back? Is it on the outside of their foot? And the foot is often a representation of how they're handling gravity, right? At the end of the day, it's like we're all trying to stay up against gravity, how we're walking, how we're running, etc. And so you might see feet that are collapsed in on both sides. I'm sure we've all seen that. It kind of gets branded as this quote unquote pronated foot, although I'd beg to argue it's not true pronation. Pronation is actually when the heel goes outward and the talus goes inward. So there's relative motion between those two bones.
Yeah.
Typically what you see is they go together, like the whole heel and the talus collapse inward. That's not true pronation. That's more considered like an internal rotation orientation of the entire foot. But we've all seen somebody like that. We've seen toes that curl, right? And so the picture that I have up on here on the top right, there's a guy where the lateral kind of three toes are more curled up, which typically is a sign that there's more, their center of mass is more over that side. So if I'm on the outside of my foot, more forward on my foot, those toes are kind of gripping the ground, so to speak.
Sure.
And then we've all seen, I'm sure, the foot that looks like you could drive a bus underneath the arch, right? So it's super high, it's rigid, and it looks like they're kind of standing on the outside of their foot, their heel. So these are all representations of how people are managing gravity, but they can also clue you in on someone's structure. And I think structure is something that people, I think in the sports world, they're not really looking at right now, which I think is a key piece. And I give huge credit to Bill Hartman on this one, who put together what's called an archetype, right? He kind of delineated these two archetypes, which there's a narrow and there's a wide. And certainly the foot can give you some good insight on what those structures are and what their biases might be. So all of these things, from structure to the adaptation that they've created to where they are, keeping their center of mass, is great insight from the foot.
Yeah, absolutely. Well, let me ask you this, for especially those who aren't, who are listening, pointing and directing to the toes that are kind of curled in. Do you think some of those adaptations could also be from guys like constantly being in tight shoes or tight cleats, and that just kind of like pulled in from that?
Yeah, no, it's a great.
Like obviously where their weight is distributed probably is a
Uh-huh.
factor, but being in those closed-toed shoes
Yeah.
restricted all the time.
to your point, I always was like flabbergasted with the Latin guys. For whatever reason, they like the tighter, smaller shoes. It's
Yeah.
part of their culture, you know. So you'd see this foot kind of bound up in the shoe, and then they'd come out of their shoe, and yes, right, like that can certainly have an influence as far as how the shoe actually fits, which is why it's important to get a shoe that fits, right? But yeah, so that would be another influence as well.
Yeah, no, it's really cool. And um I myself, this is just kind of a weird side, comment, but I had the toe spacers that you get when you go to get like pedicures and
Oh
stuff.
yeah,
I
I
put
love
those in to kind of
those.
like, yeah, because my toes, like I can move my big toe, no problem, but the other four,
Hmm.
they all just move simultaneously. Like I can't really spread them out to probably like I did kind of like having tighter cleats because I felt like I was just more control and
Yeah,
I wasn't slipping around in the shoe, right? Because I
sure.
wanted to have a little bit more grip on the ground. But that I think restricted the other toes that I had, and now I'm slowly trying to start to get a little bit
Mhm.
more dexterity to those toes a little bit. So what are your do you it may not be a low hanging fruit for everyone, but it's just trying to optimize your body as a human, right? Like,
Mhm.
do you recommend that at all for anyone to kind of, allow them to get some of that feeling back in their toes?
Yeah, I think there's something to be said. I think FRC did a great job of like talking about moving the toes, right? Can you lift the big
Yeah,
toe up? Then can you lift the other ones up? Then can you put them down one at a time, right? And all of those exercises at the end of the day are working on, just as you said, the dexterity.
yeah.
When feet are bound up in shoes for most of the day, we tend to lose proprioception. We tend to lose control of those smaller muscles within the foot. And there's a lot to be said about when you're getting into a load or when you're getting into certain positions in the weight room, being able to find certain parts of your foot. Can you feel the inside of your foot down? Can you feel your big toe pushing into the ground? That's a lot of what I do when I work on a foot, and we're gaining range of the motion of the heel moving separately from the talus and the midfoot moving. A lot of the exercises that follow that are all barefoot, just because now you've opened this door, right, this
Yep.
window to being able to feel movement through the foot. And now I want them to have that proprioception from the ground up to say, okay, actually now I can feel the inside of my foot coming down to the ground. This is actually something that Trey, who we'll talk about, he's like, wow, I've never felt my foot, the inside of, he had the high arch. I've never felt my foot hit the inside of my arch as I'm walking or as I'm doing this exercise. So I'm picking exercises to reinforce how he's putting load through the foot, so as to make some of those muscles kind of wake up, obviously to kind of connect the brain to the foot of how he's distributing load through the foot, which can certainly affect movement ground up and top down.
Oh yeah, absolutely. It's definitely kind of crazy to think about, but it's more than just ground up. Sometimes it is top down, and
Mhm.
really depending on the skill or I guess the movement at play there. But that's really cool. So yeah, the I'm definitely gonna have to share this, and I'll put it in the show notes for you guys. But just the visual picture here is really cool to kind of see the different, if you want to call it like archetypes, kind of
Yeah,
similar.
archetypes, shapes, biases
Yeah,
for sure.
yeah,
Yeah.
and
And I
a
think
lot of this, yeah,
go ahead.
probably just people on, I guess, different levels of that spectrum, right? Like they're never gonna be, just this or just that, right?
Oh,
Like
of course.
they're gonna have, you know,
Yeah.
in the independence of that. Now, one thing that a lot of people don't talk about in the baseball world is, and I think it affected my performance tremendously, is turf toe.
Mm.
Where you have like those really tight shoes or whatever, and you're constantly like rotating on the ball of your foot. More common in hitters, I think, just
Uh-huh.
because constantly doing it a little bit more rotation on that back foot, or they might bias that a little bit.
Yeah.
But it affected my ability to be able to rotate because like I couldn't even get on the inside part of that. So,
Right.
for issues like that, or maybe they can't even fully extend,
Uh-huh.
that big toe. Like, how does that affect everything else
It's a
further
great
downstream?
question. Yeah, it's a bit of a loaded question. And I think
Yeah,
actually if I get to this next, let me get to this next slide, and I
yeah.
think
Let's
we'll be
do
able
it. I don't want to
to
jump
talk
ahead
about
here.
that. Yeah. Because people will talk about like, okay, I have very limited great toe extension, right? It's very tight on the bottom of my foot. And people will just, again, kind of think locally and address the toe. Well, I got to get the plantar fascia. I got to get this specific tendon, to increase in length. But again, I think we have to think globally. And part of an evaluation is, what type of foot do you have in front of you? And this is where understanding gait, right? So there's 3 phases in gait. There's early, there's middle, and there's late. And if you understand the type of foot representation in each phase, it can give you a window of, where is this athlete's center of mass? And as a result, what kind of foot do I have? So Trey, who we just talked about earlier, is this athlete who's very narrow. He's biased toward a lot of external rotation just because of the archetype of his pelvis and basically his axial skeleton.
So yeah, for those listening, it's like the outside part of the foot.
Yeah, exactly. You can see the toes pointing out. You can see he's very supinated. He's standing on the outside of his foot. And one of the telltale signs is when I go to lie him down on the table and he's just obviously laying there with no gravity on the body, you see this foot that looks like it's called a banana. Some people call it looks like it's in a high heel. I've heard Barbie foot before, right? So hopefully that kind of gives you this visual image. And that is actually a representation of a late foot. So if you think about early phase of gait, the heel strikes first. You are in supination, but it's more of this kind of yielding of the connective tissue. So the connective tissue is soft, it's pliable. And then as you go to load into mid stance, when the foot is directly underneath you, right, we start to stretch into that connective tissue. The foot comes into pronation, right? We get more dorsiflexion. And that stretch is kind of like the spring, right? We're kind of loading the spring. And then the minute the heel starts to come off, now that foot goes back into a resupination, but that's where your great toe extension occurs. And the foot shortens back up again, and the connective tissue is very stiff. So this is where the toes start to curl up, right? The bottom of the foot has more of this rigid sort of, connective tissue. The musculature on the back of the calf, these are the guys that typically have limited dorsiflexion, right? All of those things are playing into this kind of quote unquote late foot. And so when someone says, I have limited great toe extension, I have to think about what phase are they in? Is their foot kind of stuck in? Because that's probably perpetuating some of this limitation. And it's not just a toe problem. That means I need to look all the way up at the pelvis and the foot are very much linked together. They have to be, obviously, when it comes to gait. And so what the pelvis and the foot are doing in early, they do it together. As they go to middle, it does it together. And as it goes to late. And so as we see with Trey here, his foot is very much in that late representation. He's biased toward a ton of external rotation. And what's interesting for coaches, I think, is how does this play into what you guys see on the mound? These are the guys that get to their toe really quickly, right? In the delivery, in the load. Yep. They're the guys that often have like a very crossbody stride, again, because their center of mass is very much going to their toe first. They're the guys that might have a challenge in getting into a lead leg position, right? They can't get that foot down. It stays supinated, and that really affects everything up the chain to stay in more of this external rotation position, where it's really the internal rotation, which is where the force production occurs. They're the guys that, they do all these drills for hinging, right? You got to hinge more, and they literally cannot get their butt, past their heel very much, because everything from the pelvis down to the foot is stuck more in this late representation. So I think that might be a helpful tool is what kind of foot are you dealing with? And that might clue you in on why they might not be able to have certain qualities within the delivery.
Oh yeah. Well, and I love that you mentioned that, more towards what they bias towards, like going more crossbody or to the ball of the foot. And a lot of the skill coaches just think, oh, hey, like this cue will probably just totally fix everything. But if there's a physiological problem, you got to make sure that gets solved first before you even think about it resulting in the actual skill itself. Right. Which, for me being on kind of both sides, wearing both hats, I understand how each one influences another, which I think helps me become a better skill coach, because I know, hey, I can't just cue this and expect this to suddenly change, or I'm getting frustrated with this guy that's not, changing a certain movement pattern. And he's like, he physically can't do that right now.
Right. Right. this is where like the pitching coaches, as I was saying with the Twins, were like, aha, you know,
Yeah, no,
this is
exactly.
where, right, the working in that collaborative effort to say like, let's try and give him these sorts of qualities within the connective tissue. Let's make it a little more pliable. Let's give him a foot that can get down to the ground a little bit better. Okay, now let's try that drill and see if it's more effective.
I like it.
Yeah.
That's good. Now,
Oh, go ahead.
go ahead. Yeah. So for the, I guess more towards the pitchers, right? The
Mhm.
environment does change. And my dad would always say this too, because he's, a chiropractor. I'm always on a mound. So my
Mhm.
hips are a little bit off kilter because
Mhm.
I'm on that slope. How does the environment also influence how the feet move? Or, obviously it affects a lot of things, but with the pelvis, maybe having that little bit of a, hip hike, so to speak, right? One side
Yeah,
to the other.
that's a great question. And I certainly, obviously environment is a big piece of that.
Yeah.
I think the other piece that's really interesting, and this kind of sparked my or piqued my interest, was going through school, chiropractic school. You look at a ton of x-rays, right? And you see this kind of
Yeah.
similar pattern over and over and over again, which is you kind of get this oblique turn of the pelvis, and it's typically to the right,
Hmm.
and so you're at like, why would you keep seeing this? And the chiropractic philosophy had some thoughts there, but I think one of the big ones for me was PRI, Postural Restoration Institute. They talk about like there's these internal forces literally from our liver and our lungs and our diaphragm and our, internally we're very asymmetrical, right? From the outside we look very symmetrical, but that asymmetrical influence internally drives things to create this turn, and it's typically to the right hand side. So you have this internal bias that is present in all of us at the end of the day. And then what is interesting, and I think lefties are always the hardest for me, because they obviously load to the left, right? So
Yeah.
it's hard for them to make this left hand turn, and as a result they add more layers of compensation on top of that, which is harder for me often to kind of dig through to kind of get to the core source of the issue. But then to your point, right, like asymmetrical mounds, or the asymmetrical height in a mound, the shoes, right, all of those things can certainly add some additional layers to that. Hence why your evaluation is so important, to figure out like a table test for me in terms of hip flexion, hip ERs, hip IRs, is not just looking at quote unquote mobility. It's literally telling me where a pelvis is in space. Because if you change where the sockets are, right? If I pull one socket one way, push the other socket the other way, it can change your hip ERs and IRs, right? So it's not
Sure.
just a hip
Yeah.
mobility problem,
Oh
but
yeah.
yeah, that's
Yeah.
what's so
The
interesting about
anonymous
the
of the
table test.
pelvis, they flare, both could be flared out,
Yeah,
both could be flared in or
yeah.
out. Yep. Yep.
Yeah, and actually, that's actually where I was going to go with Trey. Right? Is here's Trey. He's stuck in a later representation, which late phase of gait is biased toward more ER. If you look at his pelvis, his measures, he probably had 70 degrees of hip external rotation, and his internal rotation was about 0. Right?
Yeah.
So here you have this pelvis that's very much flared out. Right? The sockets are pointing laterally, which gives him that external rotation bias. And I think what's also really interesting for someone like Trey is when I hear, people talk about motor preference, right? In
Mhm.
terms of like more supination or more pronation. It's not just motor, right? It's structure.
Sure.
It's both that are driving this equation, right? And so with someone like Trey, I look at Trey and I say, he's going to be biased toward a ton of ER. He's going to be someone that probably has a really good curveball. Like that's where he lives. He's going to
Right.
really struggle. Yeah, he's going to struggle with a changeup. And I look at his foot, I look at his delivery, and you can see that about him. And so it's funny because I've always like, why would anyone want to like try and push him into a changeup when that's going to be a crappy pitch for him anyway, right? So how do we make this arsenal that's kind of biased toward this zone for him, knowing that just structurally he's probably never going to have a great pronation position of the arm, not just from the hand and the wrist, but all the way up through the thorax and the pelvis.
Oh yeah. No, that's a great point because, I kind of shake my head at hearing some coaches be like, "Oh, you're always cutting your changeup." I'm like, "All right, well, maybe
Well,
don't throw that. Use a split finger or something, right? Like some
yeah,
other type of off speed."
yeah.
So yeah,
Yeah.
makes
So I
sense
think
though.
that's a like a key piece, I think, in the pitching community is, what is the structure telling you? right? And then also the other piece is what adaptations have they created on top of that structure? Because you might have, and I have a slide of somebody like this, Jared Schuster, who's in AAA with the Braves, has his best pitch is a changeup, and he's a narrow guy. So you'd think, okay, he's biased toward more external rotation, but you can see within his posture. Let me see if I can pull that slide up for you. This is the guy right here. You can see like feet are more collapsed in, right? You see the calcaneus is more everted. You see the knees are kind of more angled in. The pelvis is basically more anteriorly oriented, which is pulling the femurs forward into more internal rotation. So even though his structure should be biased toward ER, he's created adaptations over time that orient his basically his pelvis, his femur, his lower legs, and actually the torso into more IR, which is why he can access that change up position. Yeah. So again, cool. Feet here, right? Feet are another cue. The lower extremity can also be a cue for you.
Yeah, absolutely. The one thing I'm kind of noticing, not to get off topic, but and you guys are more than welcome to watch the YouTube video for this, but looks like the right leg, like the knee crease. What is there a reason why you have the lines on that?
Yeah. Yeah. So what's interesting about the popliteal fossa, that's the popliteal fossa, the popliteal line, that's basically on the back of the knee where the crease is, right? When they go to bend the knee, is it's looking at the femoral condyles, right? So that's actually the bottom part of the femur. Okay. And if you orient the pelvis, if you tilt it forward, okay, it takes the crease and it creates more of this angle. So it's a way to tell you that you have an anteriorly oriented pelvis. When we talk about anterior tilt, right? Yep. His right side is far more anterior on that picture, which is why I noted that. Because again, it's telling me where he is in space. That actually plays into a really good, let me show you this picture here. So he was a guy that landed, there we go. He landed really closed, right? So look at that December 2021 picture, right?
Yeah.
So he landed really closed. The whole knee is collapsed in, the shoe is collapsed in. And as a result, that whole right side of the pelvis is really jamming forward to get down into the ground. It's trying to give him some sort of internal rotation because he actually does not have that capability within the sacrum, the ilium, and the femur. So all three of those participating together is what's considered true internal rotation. And if I can't get that, I dump everything as a unit, right? Kind of moves all together inward, which is what was happening. And he's actually somebody that had a biceps tendon issue. So that being said, we obviously did some work in the trunk, but this lead leg position was also, an axe that he was grinding with regard to his lead leg mechanics. But you can see how the change over time of getting that pelvis in a better position helped to open the hip a little bit more, got a better position of the knee and the foot. Real
quick, before you go to another slide, one thing that I'm noticing just as like more of a pitching coach, and you didn't even address it, I don't think, but or maybe you did. December 21, super uphill.
Yes. Yes. So that was the thorax that I was talking about. Okay. Yeah. So he had a left bicep issue. And so
it's hard to rotate if you're going up here and then you're trying to throw downhill. Like, yeah, your biceps definitely going to take on the toll and have a lot of, I call slamming.
Yeah.
Back to that.
Yeah. Or think of it this way. It's like when he goes to get into his back hip, for him to be able to delay a thorax, that's the rib cage being able to stay in ER, to stay open. If that rib cage is closed and I cannot open the rib cage, I can't hold my torso back. So oftentimes players use the front side coming up and tilt the shoulder as a way to keep the center of mass back. So what you're seeing there is as we gained more external rotation basically of the rib cage, he was able to hold the delay better and create better, obviously, hip chest separation without having to hold that glove side higher. So yes, to your point, that was exactly what we were aiming for.
Yeah, but you were also taking into effect how the foot and how the knee and how everything, how the pelvis was influenced. Not just saying, hey, your shoulders are uphill. Nope. Let's throw downhill, or like, I don't want to call out anyone in specifics, but you see some people where they're like throwing it into the ground and then, working their way up. I'm like, you're not really fixing the issue there completely.
Yeah, you're putting a Band-Aid on it.
Exactly. Yeah. That's really
cool. So and I think the other just to go back to like those biases, let me see if I can pull a so these are just some feet kind of going back to structurally from the bottom, we got very supinated feet, right, on the left. Same thing. This is Trey from behind. And those are, again, two players that are very much on the curveball side of things versus the two players on the right here. You see that collapse of the feet inward. You see the knees obviously tanking inward and the heel. Those are two players that change up is obviously part of their profile. So just looking at these structures, I think can hopefully give you some sort of a clue, especially the structures at either end of the spectrum, right? It's
Yeah.
the ones
So
in
you're
the
saying
middle
like
are
the ones on the left are Trey's more external biased,
Yep. Yep.
and then the other one over here on the right hand side is a little bit more IR
Yeah.
biased.
There you go. You
Cool.
got it. Yeah.
Nice. I like that. That's really cool. And you might have some videos to pull up here too, but you can really tell that as you're evaluating a guy's, just mechanics or whatever you want to call it. Like as they're throwing, you can
Mhm.
see like, hey, where does their foot actually move
Yeah.
to first, right? Or you see a lot, and that's kind of what I tend to go to first is like, hey, is their foot slipping? Are they
Yes.
going to eversion? What's that first move there?
Yep.
Uh,
Yeah, absolutely. That's a key piece to the equation is um so I this is where you can link the weight room with obviously what you're seeing on the mound, right?
yeah.
So I look at standing rotation, and as Trey goes to the right, I say, what's his strategy to get around the right side? There's going to be a certain point where, yes, the foot's going to pick up, but to a certain degree, he should be able to get 40, maybe 50 degrees of a turn of the pelvis without that right foot picking up. And you can see he goes on the outside of his foot, right? He's bringing more supination into that right foot to create a right hand turn on a standing rotation test. And same thing to the left,
Mhm.
right? And so as you look at his load, which we can go to a picture of his load, he's a guy that, as you said, he toes out, right? He slips because it's like, I don't have enough range within this whole lower extremity to hold on to some internal rotation. I got to toe out a little bit to give me some more room,
Sure.
right? So looking at someone's strategy to get into a position often links up with what you're seeing from video on the mound. The other one too is like looking at a toe touch. You can see when we talked about phases of gait, right? Early, middle, and late. A late representation is this pelvis that's being pushed forward, right? Just like the foot is driving it in that position. And so when someone does a toe touch, I want to see how much posterior weight shift are they getting, right? If they have a pelvis where the sacrum can nutate and we have some elastic, capabilities on the backside of the pelvis, I can get my center of mass to move back. But if everything is closed down, I have a tighter connective tissue back there, you'll often see the pelvis stay more over the foot, which is exactly what Trey is showing you here in his toe touch.
Hmm.
And then as we get to like, here's obviously his load from a couple different angles. You see that peak knee lift, that toe is obviously turning outward.
Yep.
You see the pelvis is very much, forward over the foot. Now he's going to be a guy that by nature of having a narrow archetype, he's not going to have this big hingy load, right? He's not going to be, he's going to stay in this upper zone. It's going to probably look a little bit more squatty. Again, that's because of the structure of the pelvis.
Hmm.
But for him, I would like to see him maybe get a little bit deeper into that position, and knowing that he's got this late representation of the foot, of the pelvis, and perhaps that gives him a little bit more internal rotation for a cleaner load at the beginning.
Yeah, I like that. Now, to your point too, like he's kind of running into these structural points, and then what I was always emphasizing is like, hey, because of that, his pelvis was having to come out, and his center of mass really was kind of more going towards the left-handed hitter
Yeah.
versus continuing to kind of have more of a straighter direction towards
Yeah.
home plate.
Mhm.
So with that influence is obviously because he's shifting around from the foot, like you said,
Mhm.
biasing a little bit, maybe a little bit more towards the toe. So what would be, I know this is kind of a loaded question too, but what are some things that you could think of, more in season, like on the spot, like things to kind of help fix that versus, and
Mhm.
it's not going to completely fix it, but it's like what's something you could do to kind of have a quicker fix, but then also keeping in the back of your mind, hey, later on in the off season, we got to fix this
Yeah.
bigger issue.
For sure. Yeah. So this is where, again, we talked about, let me give him some motion in the foot, right? Let me
Yep.
make that calcaneus evert a little bit better. Let me make that midfoot come down a little bit more. So he has some of the motion within the foot. Then from there, obviously we talked about exercises with shoes off. So
Mhm.
he was somebody where we did like a reverse sled drag. So TRX, like hipped up to a sled, right? He's holding it palms up. And I literally have him just walking backward, because it's taking him farther back into an earlier phase of gait, right? Versus let me push a sled, right? Pushing a sled is putting him into a later phase of gait, which is reinforcing the problem, right? So a
Mm.
sled drag would be a good example of, how do I now work into that mobility of the foot? How do I get him back toward his heel a little bit? How do I also affect the pelvis at the same time to get into an earlier representation? Another example in the gym might be, rather than a back squat, right? So if I put a bar on my back, that's literally pushing my center of mass forward. That would be a later representation from the thorax and the pelvis, versus let me give a front squat to him, right? So now again, I have to shift my center of mass backward. Other examples might be like a front foot elevated split squat. So the foot elevation on, let's say, like a couple DC blocks keeps my center of mass back. As I get down into the bottom position of a split squat, I'm literally creating more internal rotation from the femur, from the pelvis. So I'm working on mobilizing, working on the yielding of the connective tissue through that whole pelvis, and working on that foot contact. Can he maintain the inside of that big toe and the big heel at the bottom of a split squat? Or do you see the guy rocking to the outside of his foot? Right? Like, this is where, again, technique in the weight room absolutely matters, because if you're seeing somebody on the outside of their foot at the bottom position of a split squat, they don't have the range to access that position. And it's just feeding, again, kind of bad patterns. So even a contralateral kettlebell on the front foot elevated split squat would kind of bias him more to the inside, biasing more internal rotation. Does that
Yep.
make sense?
So yeah, just for listeners, kind of explain this a little bit more. Contralateral being, let's say the right foot's forward,
Mhm.
and the kettlebells is being held in the left hand.
Left hand. You got it. Yeah, like that. You're gonna down by, either you could do a racked position or you could do down in front of you. But those are all ways, right, to create this influence of, do I get the center of mass toward the inside of the foot? Do I get the center of mass toward the outside of the foot? Split stance versions are great at creating better turns versus bilateral activities. Obviously, by definition, a bilateral activity, you don't want to rotate, right? And if this kid is missing those components of rotation, I'm probably going to bias a program toward a lot of split stance positions, single leg stuff, those sorts of exercises. So without having to mobilize, maybe giving them too much mobility and therefore kind of creating some sort of issue with command or just not feeling right on the mound, I might sway his program of lifting towards some of these activities, which tend to be a little, easier for people to accommodate to acclimate to, while improving some of these qualities of rotation to get into that back hip.
Yeah, I really like that because you hear about all these different types of ways you can manipulate exercises, but I think you put it really simply on how that relates to gait
Yeah.
and how that's actually coinciding with your exercise choice, which makes total sense.
Mhm. Yeah. And even like, you know, doing more of an eccentric lower, right? Like I'm doing a 3-second lower on the
Oh yeah.
split squat, right? That's really going to help with that connective tissue, creating more of a yield, right? Creating more of a stretch versus something that's more like springy, fast, right? That's going to be a tighter connective tissue. So again, it's like, if we're trying to affect the whole chain, if we're trying to get this more kind of yielding, elastic connective tissue, that also has to play into your programming as far as tempo, things like that.
Yep. Yeah. No, 100%. I love that. That's really cool. And a part of it too, like just kind of reflecting back from split squat versus regular squat, right? I've seen it countless amount of times where guys like, they have either like a butt wink where their butt kind of
Yeah.
tucks under, or like, they're doing a squat and they're also very rotational and then
Sure.
their pelvis actually even shifts. And I'm like, yeah, I don't want to put extreme amount of loads on top of that pattern.
A
You
good
know?
idea.
Yeah.
Yeah.
Yeah. So I'm like, all right, yeah, we're definitely not doing back squats or any type of like normal bilateral lifts until we can figure out how to
Yeah.
do this, maybe less loads, sure. But if you're seeing that big of a shift, like that's just a
Mhm.
recipe for disaster.
Mhm. Yeah,
Yeah.
I mean, essentially, it's like they're showing you that there's an asymmetry going on, and a significant one,
Sure.
right? And so it's like, why am I going to ask them to do a symmetrical exercise, right, with load on an asymmetrical system? It's not handling the right. So something somewhere internally has to be able to compensate for that, and oftentimes it goes to a spine, right?
Mhm.
So to your point, it's like these kind of single leg split activities can help with those guys that are really asymmetrical, because it allows for more rotation, more turns to happen, which means that you're distributing some of those loads rather than focally putting it in a spine.
Yeah. Oh, I like that a lot. Um, One thing that also kind of comes to mind, and I'll circle back with this a little bit, is guys who, they might hit right or throw left or vice
Mhm.
versa, right?
Mhm.
And it's kind of interesting to me how they could hit really well and they're able to hinge in their hitting pattern, but then they go to their throw and they're like, ah, I can't really connect the two, and they're stuck, or they, have that more of a squatty pattern, or a little bit more, you know,
Mhm.
leaning towards or leaning forward what they're choosing. So I've honestly just been like, hey, like try to feel the same thing, just kind of find out like where your body is in space
Mhm.
without really having to give them all these anatomical cues. It's like, hey, like let's do a scoop toss on that hitting side and then
Mhm.
try to recognize what you're feeling and then go to the other one. It's
Mhm.
obviously a little bit more elementary than um some other people would think, but it's like, hey, like there is another, way to, if you can feel this,
Mhm.
maybe you're able to link that to the other side.
Yeah. Yeah, to your point, like I look at it from a point of change of direction, right? At the end of the day, like pitching is change of direction,
Mhm.
hitting is change of direction, and all of those things are gait. So again, we go back to the beginning, right? There's an early, there's a middle, and a late. And I think where I really started to learn about this was teaching speed change of direction mechanics. Is you'll see a guy they're great at change of direction on the right side, right? They get into the
Mm.
load really well and they get out of the load really well. And then the left side, it's like they almost kind of stop short, maybe like they don't get into the load all the way. So I look at it as you get into the load, that's the early phase of gait, right? As you start to change direction and you break the heel off the ground, that's middle phase of gait. And then as you extend and push off of that leg, that's the late phase of gait. So I break it into three components and I say, which phase can't they access? Because if I can understand the phase they can't access, then I know the shape that the pelvis has to create. And if I know what that is, I can work on that from, if I have to do it from a manual standpoint, if I have to do that with certain exercises, okay, I need to get into an early phase of gait, getting into a cut. So maybe I'm going to do a chop from right into my left hip. That's the early phase of gait, right? Which
Yeah.
as I get into that position, I'm creating more sacral nutation. Well, I'm basically biasing to an earlier position, which is the ilium has to come back into like an ER position. The sacrum starts to turn. Like there's certain positions that you have to understand are happening between the pelvis that represent that phase. And so same thing goes for hitting, right? If I see a guy that he has a really great representation of late, he pushes out of that back leg really well, but he can't create quote unquote the coil to get into the hip, then I know I probably need to work on early representation with him. And to your point of left and right sides, we talked about that asymmetry. So you may have a guy that's on that kind of oblique turn and they can access early on one side because they're turned into that side, but they can't access it on the other side because the other side's pushed more into a late phase. So that's where it gets really interesting of understanding these turns. But again, breaking it down to simple things of early, middle, and late. What phase can't they access? That's what I need to work on.
Yeah. No, it's very simple, very simply put. It's like, hey, where are they at? And you're finding their spot in the
Mhm.
roadmap, I guess, so to speak. And you're like, all right, let's attack this.
Exactly. Yeah.
Wilson.
Yeah.
Now, not to kind of like, I guess I'm kind of poking a hole in this. Do you ever want to expose them to other types of, of that training? Like obviously they're getting stuck in these positions, but do you ever not allow them to do something? Or let's say
Yeah.
Trey, goes to school and
That's
it's
a
like, hey, I got to do bilateral lifts. So
Yeah,
then,
100%.
yeah.
Yeah. So I remember working with a pitcher and like probably one of the best changeups in the game. And and you look at his entire right side, but he's entire right side, righty, and he has created all of these compensatory changes to get his arm, hand, shoulder, etc., into that position.
Yeah.
And he clearly did not have access to an early representation. He didn't really have much of a middle. It was more of a compensatory strategy toward middle.
Okay.
And he was kind of stuck into this late phase. But it's like, I'm not going to touch that, because if I touch that and I bring him all the way back to early, I just took away one of the best changeups in the game. You
Yeah.
know? So
Yeah.
that's where this stuff really gets hard, because I have to have those conversations with the pitching coaches or the hitting coaches to say, like, what does this guy do really well? I really don't want to screw that up. Right? Is there
Mhm.
something that we are trying to improve upon? And I can say, look, if I try and give him more of this, it could take away from that. And if you're okay with that, then let's do it. But if not, then let's not touch it. So yes, to your point, there are times where you don't want to quote unquote fix something like that.
Yeah. No, makes sense. Definitely makes sense. Well, I guess for some of the listeners here, like what are some other than I think the lifting examples were really great. And then, talking about, warming up the feet, what are some other ways on how other, I guess, just practical applications
Mhm.
to kind of help them either identify or also kind of allow them to feel out for themselves like, hey, like, okay, if I do some of these walks like a little bit more here, or maybe even just videoing themselves. I don't know. What are your thoughts on how they can kind of help them understand how they're moving?
Yeah, I think to your point, like I'm a big fan of like take your shoes off, right? Like get your feet in the
Yeah.
grass, go through different positions, walk heel to toe, right? Go to the inside, go to the outside, wake up the toes a little bit, right? I think those are all, great strategies to for everybody
Yeah.
to kind of make that connection into the foot. Um, I think it's also important for coaches to kind of look up the chain, right? And what is the pelvis telling you in relation to the foot? What do you see in relation to the shoulder? Right. And I don't think standing rotation, squat tests and toe touches, I don't think that's just for the sports medicine group. I don't think it's just for the S&C staff. I think there's a lot that coaches skill coaches can glean from those tests
Yeah.
that can link up with what they're already seeing, from their actual swing or from their delivery. And when you can link those up, I think it gives people somewhere to go. Okay, we're seeing the same strategy here as here. So maybe it is a true limitation, right? Maybe I do need to have a conversation with my S&C or my, sports medicine person. Um, I think I have to actually give a big shout out to Bobby Hearn here. He's one that I collaborate with quite a lot. This was
Bobby.
a drill that that your old roommate, right?
Yeah.
Um, that he came up with. Like, I love that. I have, Bobby Hearn, Justin Willard, who's with the Twins, Zach Bove, who was with the Twins and now actually is with the Kansas City Royals, JP Martinez. These are all guys that I worked with at the Twins organization. And they were really open to saying, let's learn some of these concepts around gait. How do we apply these to drills we're already doing in terms of plyo drills? So this was something we did with Trey, which he obviously, after gaining motion in the foot, we did some drills to kind of, can he access the inside part of his foot? And what he's doing is just this foot rock. So he's rocking forward on his toes, back on his heels, forward on his toes, back on his heels. And then he actually goes into his delivery. And what's interesting is, before and after, did it help clean up what we were seeing? Which I'd say he's far more, linear toward home plate on that. You can see him get into a better load position. I see better qualities within the torso and the pelvis that tell me he's accessing more of that kind of middle phase of gait. So linking up what you're already doing from a plyo perspective and understanding, if I get the center of mass more toward the heel, or if I create more of a delay by maybe having them throw with, stepping up onto like a DC block, I create some of these changes with regard to center of mass that play into gait, which they then change the position of the pelvis, the thorax, the foot, etc. So I think there's a lot to be had here in this arena with coaches. Of kind of taking these concepts and applying it to plyo drills you're already doing.
Yeah, I love that. And I'll just kind of add in some stuff here too. It's like,
Sure.
yeah, they get it, a feel for it, and then try to get them on the mound. You
Yeah.
know, get it
Yep.
to be as specific as possible as you're doing more skill specific stuff, such as throwing.
Mhm.
Makes total sense. Yeah, I'll let you continue.
Yeah, no, that was it. I think, like I said, just having maybe a different perspective of within the plyo drill of what are we actually trying to achieve here, right? What kind
Mhm.
of shape or position are we trying to get this guy into? How do we replicate that with some of these drills? Yeah.
Oh, yeah. I love it. I love it. Well, any other closing remarks, thoughts, questions, and also how can listeners get a hold of you?
Yeah. I have a Twitter obviously account, so it's actor at Dr. J Reiner, and Instagram is going to be the same thing. I typically just try and put a lot of kind of visual things up there just to show differences and bring the eye to different things, and kind of propose some different theories of why certain things are happening. So yeah, so follow me there, ask questions, create dialogue. I think this is what moves our industry forward.
Great posts too. Love following them along
Appreciate it.
as well. Yeah. Awesome. Well, yeah, for those of you listening, feel free to reach out to her, follow along on her post, and stay in the zone.